Good morning. It is great to be with you. You're well served by an outstanding board of directors. You see the infectious, enthusiastic leadership of Audrey and David and Wynn and others like them, and you've got a great staff. Many of you are telling us this is the best meeting that you've been to of ours. We're grateful to hear that, and our staff deserves all the credit. I hope it's a great experience. Here we are 2 weeks before a critical election, and we find ourselves at a crossroads between old and new eras, between our collective responsibility for each other through government and philanthropy, and individual responsibility for those of us who encounter health or other difficulties. A crossroads between the familiarity of the status quo, however difficult it has become, and the risks of innovation. We're even at a paradoxical crossroads of ample and scarce. Yes, we have more than enough resources in some sectors of what we do, and precious little in other sectors. And perhaps one of the most important personal crossroads that any of us will face in lives with ourselves and our families are that crossroads of prolonging life and forestalling dying and death. And somewhere at the crossroads of leadership that shapes our future and being swept away by powers we think we can't influence. Ominous junctions, these crossroads, but that's where we are, isn't it? We feel it every day, see it every day on the television. There's no mistaking the far-reaching nature of the next road we take. Our choice of highway has far-reaching impact on future generations in the face of our country's demographic imperative and economic situation. And at these crossroads, the traffic noise of the spin, the theories, the studies, the opinions, the politics of it all can easily distract us from thought, vision, and leadership of a sober and critical nature at this time in our nation's history, where our social ethos as well as our economy are under great pressure. And when I talk about leadership, I don't mean necessarily the leadership of gurus or elected officials or bureaucrats. No, I mean the role that your thoughts, your vision, and your leadership must play at this crossroads. You see, I am firmly convinced that your leadership is essential to the improvement of the aging experience in America, and the improvement of the aging experience in America is the number one key to healthier families, healthier communities, and a healthier economy. Because your leadership is based on the fundamental values of this country: justice, mercy, opportunity, and choice, which you fulfill every day in your communities for the people you serve. You might say, who? Me? You ask yourself, has Larry lost his mind? Don't answer that. Did he say we are the ones to lead this country away from an economic cliff toward a healthier future? That's exactly what I said. You see, you are the people in every community in America who give their community's heart, soul, and hands to meet difficult needs every day. You're the people that de Tocqueville said 150 years ago, enlarge the hearts of our communities. You're the ones who are responsible for vulnerable seniors and younger people with disabilities. You tend to them the 355 days a year they aren't in the hospital, and the 22 hours a day they're not in the doctor's office or an emergency room. You know that the poorest of them, the so-called dually eligibles, who represent a minority need of Medicaid and yet a near majority use of those dollars. You ensure that they are well cared for through innovative clinical programs, through coordinated services, decent housing, food, transportation, and just plain caring for people every day. And you know better than anyone that care and service for the least of these is not only a humanitarian mandate, but good economics. You know how to do better for less, where dollars and lives can be saved. That intersection of where values meet value. Dr. Gawande reinforced this assertion yesterday in spades, didn't he? Small things we do for people with the greatest needs make a huge difference. You know the people he's talking about. They live in your communities and are served by your programs. You're the ones that know that decent and affordable housing is the basic ingredient for health and stability of any of us. Health begins with a place people call home, but especially people who are vulnerable. You know that low-interest capital to assure safe and decent housing is not a welfare program to be eliminated, but an essential catalyst for improving the health, for delaying moves to higher levels of care, and reducing expensive emergency room visits. You are the ones who know that families, friends, and volunteers fulfill our collective responsibility to support those in need in immeasurable ways that yet have an economic impact. You know better than anyone else how public policy should be changed to enable families and community to do their duty in the face of outdated rules and often special interested-driven legislation. You know how government can best help and where it should get out of the way. You know that enormous taxpayer expense and personal angst is unnecessarily spent and magnified at the end of life because of unresolved emotional conflicts, fear of liability, and lack of adequate planning on our parts. You know how to help our society age gracefully and finish life with dignity and hope. You know how to help every family plan for late life decisions. You know how to help families and providers mitigate the stress of transitions and the costs of poor care coordination among providers, however well-intended they are. You know that aging has a fulfilling purpose in life. You live in service communities of all kinds where fun happens, new relationships are formed, new ways to serve are invented in behalf of and with those who now we call, quote unquote, retired, an increasingly antiquated and someday charming old term. You know what our founders understood 50 years ago, that the fundamental problem to be faced by an aging society will be to eliminate isolation and boredom. You know that caregiving is noble, paid, and volunteer work that not only provides jobs but relieves stresses in potentially every household who has an aging parent or disabled child, you are well aware that recruiting, respecting, and retaining a competent workforce is the key to all of the things I've mentioned above. Yes, you are at all of these crossroads, possessing the knowledge, experience, and wisdom to successfully expand the world of possibilities for aging, and in doing so, steer our country back on the right path. So what are we doing with this knowledge, experience, and wisdom? What are your hopes and visions for the future? We surveyed and interviewed hundreds of you in the weeks leading up to this meeting. Surprise, only 3 out of 600 written responses to a survey we sent said you'd be out of business in 5 years. The rest speak of, or write of, growth in mission, becoming better stewards of resources, improving your management and governance capacities, employing the use of technologies, developing leaders, reaching beyond your walls. In fact, we now believe that you're serving more people beyond your walls now than within them. Yet you're upgrading those walls, building new specialty wellness programs, and renovating and creating things like greenhouses and small houses and outpatient clinics. And you want to know how to do lower income housing to complement your services. And you're learning to partner with others in the community. Many of you are actually leading those collaborative efforts, which can be very complicated relationships. You are broadening your mission and thereby sharing your experience and instilling that wisdom to a much broader audience. Yes, you are enlarging the hearts of your communities. At this critical crossroads, you're also asking the right questions and coming up with innovative solutions. Questions like Evangelical Homes of Michigan, who ask, who aren't we serving and why not? Or Mather Lifeways, how do we eliminate the impossibilities? Or Chelsea Jewish Foundation, are we making our Lou Gehrig's disease and MS residents as independent as humanly possible? If not, our work is not done. Or, as American Baptist Homes of the West ask, are we giving back to our community more than our community provided to us in tax exemptions and charitable deductions? Or, what is our responsibility for the poorest of the poor? Elder Care Alliance asks, as they serve 2,700 of that very population in the Bay Area with food on a regular basis. Our speaker that you'll hear shortly asked me backstage another great question. Are your members the ones that a daughter can trust when the phone rings in the middle of the night and people have to make decisions? That's a question from a friend from the outside. Yes, you are at the crossroads where you're asking the right questions and you intersect where public policy and programs must come together. Where the ever-increasing expensive ills of society can be converted to progress that promotes health, independence, and responsibility. You are the leaders at the crossroads, the quiet, thoughtful, values-driven leaders. To be successful at this tremendous leadership responsibility to keep our country on the right path, we also ask you in these hundreds of responses, what do you want us to do, LeadingAge, to help you be successful in the future? Over and over, in one way or another, you want us to do things like this. Keep the big and bold ideas coming. Don't let us be complacent, says Russ Denbraber from right here in Denver. I promise you we will do that. We will push on those edges. We will bring you the best strategic planning and visionary thinking we can possibly find for you. We try our hardest to attract the best thought leaders and gurus for our meetings every year, our workshops, and our states do the same. Keep highlighting innovative things, says Godwin Dixon, Presbyterian Homes in Texas. Our innovation fund is going to lift up innovative things that you're doing, and that's only the beginning, because we know that the not-for-profit sector is the crucible of innovation in our country. That's a role and responsibility you may not know you have, but the history of doing so is unmistakable. Help us figure out how to partner, said Todd Swartzell of Presbyterian Home, a request echoed by many. Learning to partner will help you do just that in 4 dimensions. Of course, Archbishop Tutu reminded us of the basic partnership dimension we all share, and that's the partnership with our Creator to make a better world. At a business level, we're going to bring you experts and programs that help you learn how to partner better with each other as well as with other groups in your communities and among ourselves through initiatives like what we're doing with New Cortland or Mather or others. There's more we can do together than any of us can do singularly. The most important partnership probably is that with the people we serve. The caretaking paradigm is being replaced by the partnership dynamic. It's up to us to work with the people we serve to define their quality of life around their choices and how we help them enable their final days. It's called consumer-directed care. Bob Dahl of Elam Care in Minnesota says, get rid of gridlock. And he adds, help us get rid of some of this regulation. We've got to keep pounding away at the rigid mindsets of regulators, and to do so, we have to show them there are better ways of doing this for which we can be held accountable. That's where our partnering with government has to continue to improve, and you do that on a local level every single day. And we want to keep inappropriate legislation away from the service categories many of you provide. Things like continuing care retirement communities, which, by the way, the R word is vanishing. What are those communities now? But it's not much about retirement, is it? But it's non-regulated from a federal basis. So is assisted living and housing with services. And the way to keep federal legislation away from those categories is to take responsibility for the quality from the day you open that service. And we've got to do more of that together. Represent us well, says Carl Macaluse of Luther Care in Pennsylvania. Our new Public Policy Congress has worked diligently this past year, 150 of your colleagues and peers, to define and redefine our principles around which our advocacy agenda will be vigorously pursued by you and us, with the Congress and the administration. More leadership development, said many of you. We will not only advance the work of our academy, but we plan to create a well-organized trustee leadership development program along with the expansion of many of our other leadership initiatives. It all starts at the top. It begins with boards and CEOs. If the leadership is not there, it's very difficult to follow a course that's responsible. Be a voice of encouragement, says John Kotowski of Lutheran Senior Services in Missouri. We know that what motivates all of us to do this difficult and important work is the support we receive from each other every day. Sharing your hopes, calling somebody to be able to solve a problem. There's not a problem you have that one of your colleagues hasn't found a way to solve. Sharing dreams and successes. But our voice of encouragement is an echo of your voices. And those echoes appear in every workshop at our state and national meetings, along with articles and papers and case studies. The literature is there, the examples are there for all of us to follow, and they're largely developed and driven by you. And finally, Jeff Freimark of Miami Jewish introduced a term to me that Archbishop Tutu also referenced. It's called Tikkun Olam, which means our shared responsibility for repairing the world in partnership with our Creator to help our neighbors. Tikkun Olam. You're the leader at the crossroads. The highway we need to follow clearly is Tikkun Olam, as you have done for generations. And I promise that LeadingAge will fulfill our promise to you to inspire, serve, and advocate as never before. That is our leadership responsibility together. Thank you. God bless. Move boldly down that road.